COVID-19 vaccine is now available for kids ages 5 to 11 years old and older. Here to answer your questions is Dr. Kristen Moffitt, an infectious disease specialist at Boston Children's Hospital. Dr. Moffitt, thanks for being here.
Sure. Thanks for having me.
So, Dr. Moffitt, let's go through what we know about these. 2 shots, 3 weeks apart, each one a smaller dose than the adult vaccine. So what kind of side effects, if any, should parents expect? Because we know a lot of adults did have side effects.
Indeed, a lot of adults did have side effects, myself included. What we know from the data from the thousands of 5 to 11-year-olds that received this vaccine is that the most common side effect was pain at the injection site. That was actually quite common, occurred in the majority of children, but not unusual at all for anyone getting a vaccine. Beyond that, the next most common side effects tended to be more typical after the second dose, and they included fatigue in about a third of kids who got the vaccine, and then they included some headache and some muscle aches in less than a quarter of the kids who got the vaccine. There was only a very small percentage of kids who reported a fever after the second dose, about 6%, and in general, the frequency of any of these side effects tended to be lower than what was seen in the 16 to 25-year-olds who participated in the Pfizer trials. So I think that tells us a lot about what we might expect, but we also just might expect these younger kids to be less likely to have side effects than we ourselves did, or maybe even adolescents and young adults.
Oh, well, that's good to hear, of course. Okay, so let's get to some questions from our viewers. Jeremy wants to know, he says, our son turns 12 December 18th. Should he get the smaller vaccine now or wait until he can get the adult one?
My answer to that would be that he should get whichever one he is eligible to get as soon as he's eligible to get it. Vaccines traditionally are not weight-based. They have almost always been age-based. And that's because, unlike a medication that tends to be weight-based, especially for children, we expect the effect of a vaccine and the immune response that it generates to be more related to a child's developmental stage of their immune system than to their weight. So I think that families of older children in that 5 to 11-year spectrum, or families of children who maybe are more the size of a 12 to 13-year-old, but their child's only 10 or 11 years old, can still take reassurance that there were children of all sizes included in the 5 to 11 age range, and they all achieved very, very good immune responses with this 10 microgram, this lower dose, and comparable immune responses even to the 12 to 15-year-olds and 16 to 25-year-olds who received the 2-dose 30 microgram series. So your child won't be shortchanged by starting the lower dose now. And I, again, would encourage families to start whatever vaccine we know is safe and effective, and that would be this one, and start it as soon as you can.
All right, here's another question. Morgan writes, our elementary school offers pool testing. Should vaccinated students be removed from the pool? Are they more likely to get a false positive?
There's no reason that getting a vaccine would make you more likely to have a false positive test for COVID-19. That would not be expected to be the case at all. False positive tests can happen, but they would be completely unrelated to a person having received a vaccine or not. So I don't really see any reason to exclude vaccinated children from pooled testing. I think that's especially true if pooled testing has been found to be helpful in different school districts, if it indeed has identified some otherwise asymptomatic or very mild infections. We would expect any infection, even asymptomatic ones, to be less likely in children once they've been fully vaccinated. But we do know that breakthrough infections can happen. So I think leaving those children in the pooled testing would be completely fine, even once they're fully vaccinated.
Okay, and this question comes from Dana. Is there anything that my daughter can take before the shot so she doesn't get sore? And I'll add to that just any other tips. I mean, drinking more water, any tips for parents?
Yeah, I think staying hydrated in general is a good idea. I think if you have a really active 5 to 11-year-old, if they participate in an activity that requires a lot of like the shoulder muscle usage, just know that for the day or two after they get their vaccine, they may be a little bit more sore and a little bit more sensitive to some of those activities. I wouldn't necessarily recommend that families take something proactively before their child even gets the vaccine, but know that if a child is experiencing experiencing some of the muscle aches or some of the pain at the injection site after getting the vaccine, if it's really bothering them, we know that you can give them Tylenol, you can give them ibuprofen, and that these side effects would respond very quickly to any of those medications.